go over some of the basics of Medicare and what's new. However, I do have some information specific to leukemia and lymphoma patients about bone marrow and also about medications. One of the questions that I get asked is, what is the difference in Social Security, Medicare, and Medicaid? Well, Social Security, you pay into a fund, and then once you retire or become disabled, they will pay you a part of that back. Medicare is just health insurance, okay? And then Medicaid is a program for low income. So, do you have to enroll or is it automatic? Well, that all depends. Yes, if you're on Social Security, you're automatically enrolled. However, if you're not drawing Social Security or SSI, then you do have to enroll. And then what does Social Security have to do with Medicare? Well, number one, if you started Social Security, you are automatically enrolled. And number two, they will deduct your Part B premium monthly from that. I'm going to go over that a little bit in more detail later on. So, what do you do if you're turning 65? Well, if you're turning 65, I hate this thing. Let me show you. Bring it with me, okay? Because I like to move around. Can you guys hear me okay? Okay, as long as I stand still, right? Okay, so there is a 7-month period for when you turn 65. It's the 3 months before your 65th birthday, the month of your birthday, and 3 months after your birthday. Now, what's important to remember, guys, okay, if you're going to wait until after your birthday, that means you're not going to have insurance during that particular time unless you qualify for insurance through your employer or for those who are on TRICARE or whatever, and I'm going to get into that a little bit later on. Now, if you were under 65 and on disability, you qualify after 24 months. So if you have not rehabilitated within 24 months, both the federal government and the medical industry agree you're probably not going to. So you're deemed Medicare eligible in that 25th month. Now, there are 2 diseases where you can get qualified for Medicare eligibility immediately. One is ALS, Lou Gehrig's, and the other one is end-stage renal disease, okay? Actually, let me go back to this for 1 second. Cancer patients or stroke patients or anybody who is under 65, I said there's a 24-month wait period. Oftentimes, the minute somebody gets diagnosed with something, they don't apply for disability. So if you have been, if you've been sick for quite a while, and as long as you have your doctor's reports and so forth, you can request your disability to begin whenever you first got sick, okay? Oftentimes, people don't want to apply for themselves. They'll get an attorney because you usually get denied the first few times that you do it. So if you're not wanting to use an attorney, just make sure that you have all of your medical records and your records from your pharmacy also to help your case. Now there's different enrollment periods. So when you're turning 65, that's your initial enrollment period. There's a special enrollment period for people who are retiring past 65. And right now, we're coming up on annual enrollment. So every year, if you're on a Medicare plan from October the 15th to December the 7th, you have the option to compare your current plan with with all the new plans for next year. And then there's a general enrollment period, because sometimes when people are not on any medications and they're very healthy, they'll go, I don't need insurance, and they won't enroll. And then later they find out, oh my gosh, I'm going to get a penalty. So the minute, for those who have not enrolled for whatever reason, and they are Medicare eligible, every year from January the 1st to March the 31st, you can apply for your Part A and get a Part A. So if you apply in January, you'll be able to start your plan in February. If you apply in February, you'll start in March. If you apply in March, you'll start in April. If you apply in April, does anybody know what happens? You have to wait till next January. So now you're going to get two nasty penalties. One for not having a drug plan, one for not being enrolled in Part B. So get with somebody, get with a broker so you can find out what those specifics are. Or if you have a family member or a neighbor who's not familiar, please share this information with them. So right now, October the 15th, that's today. Instead of me writing policies, I'm here talking to you guys, okay? So I have a heart for this because my brother developed leukemia last year and was in Northside Hospital for 4 months. And the nurse out there told me that he was one of her patients. I mean, that almost made me cry. I had no idea whenever I booked this. So my heart's with you also. So during this time, if you have an Advantage plan or a drug plan, you can compare all the plans for next year and switch your plan. Now, if you have a supplement plan, that's totally different, okay? Supplement plans, you can change those plans any month that you qualify, so you don't have to wait until annual enrollment. But for those who are on Advantage plans and drug plans, now's your time. Also, I don't have this in here, but I thought about it. This is just good general information. For those of you who are on a plan, okay, every year during the month of September, they send out a little booklet called Annual Notice of Coverage. And what that booklet does is it compares the plan that you're currently on with the plan for next year. And it starts at the very top, like if there's a premium, if there's a deductible, and then the cost. So every year, for those of you who are on Medicare, or if you're a caregiver for someone who is, check that against what's going to be happening for next year. Open enrollment, once again, that's January the 1st through March the 31st. Now, open enrollment is something that Medicare hasn't always offered. So this is for folks who are on Medicare Advantage plans only. So if you're not on the Medicare Advantage plan, you can take a nap and then I'll wake you up whenever we get ready for the next part. Okay? So for those who are on Advantage plans, though, listen up. During open enrollment, that's when you make your choice, or if you don't do anything, your plan will just roll over to the next year and you'll have your same plan, okay? But what Medicare allows you to do is take your Advantage plan for a test drive, okay? And if you like it, you can stay. However, if you realize you maybe made a poor decision during open enrollment, or your needs have changed, okay? If you get a diagnosis after you made a plan, after you have made your change, then, or maybe your medications have changed, your doctors, whatever, you get a one-time opportunity from January 1st to March the 31st for Advantage plan only to change plans, okay? Now, you can either change to another Advantage plan, or you can change to a Part D plan. But remember, if you don't add a supplement plan, you're not gonna have that additional medical. So before, if you're wanting to go from an Advantage plan to a supplement, a standalone drug plan, do this early, like do it in January, or February. You want to make sure you medically qualify for a supplement plan before you lose your Advantage plan, okay? Does everybody understand that? Could you shake your head if you do, or not, because I'll repeat it. Good. You guys are doing great. So, how do you qualify for Part A and Part B? Well, Part A is deducted from FICA taxes, okay, also known as Medicare taxes, during your working years. So once you work for 10 years, which is equivalent to 40 quarters, you have self-funded your Part A. So if anybody ever says Part A is free, oh heck no, it's not. You paid for it, and you paid for it a long time, okay? It's just when you become Medicare eligible, you don't have any further premium to pay. Now, Part B does have a monthly premium, and it starts when you become Medicare eligible. And the 3 times you become Medicare eligible are when you're turning 65, if you're retiring past 65, or you're under 65 and on disability. Remember that? Good. So far, am I presenting this and everybody understands, or have I gone too fast? Oh, I love all the thumbs up and the yes. Very good, very good. So you can come in, we've got some seats over here on this side. So let's talk about the parts of Medicare. So if you could envision your Medicare card, on your card it's got Part A and Part B. Well, Part A, beside that, says hospital. Part A covers you while you're in the hospital, while you're in skilled nursing, and if you're in hospice. So I like to say that Part B covers you when you are sick and in the bed. Does that help you kind of have some point of reference? So hospital, nursing home, or hospice. Excuse me. Part B on your Medicare card, beside it says medical. Now that covers a whole lot of territory, okay? Because it's going to pay for your treatment, whether you are in or outpatient. It's going to pay for your doctor visits, your doctor services, and medical supplies. So what that means is when you go to your doctor, what do you need? Do you need for him to stitch you up? Do you need brain surgery? Do you need joint replacement? It's going to pay for your doctor to provide that service. And then whatever medical supply he may need to perform that service. It's going to pay for your blood, whether you're in the hospital or out of the hospital. It's going to pay for diagnostic tests. Do you need an MRI, a CAT scan, a biopsy? It'll pay for that. Durable medical equipment, that's like walkers, wheelchairs, rollators, CPAP machines, oxygen falls underneath durable medical equipment. And your therapies, like physical therapy, speech therapy, and so forth. And Part B, drugs. Now, this is the group that's really interested in Part B drugs versus Part D drugs. So Part B drug is a drug that's administered by a doctor or a nurse practitioner, and it's like injections and infusions, okay? Whereas Part D drugs are pills, ointments, eye drops, that type of thing. So Part B, as in baby, is covered under original Medicare, and it's injections or infusions. Does that help you guys understand original Medicare, what Part A and Part B is? Great, great. So if you only had Medicare Part A and Part B, that's referred to as original Medicare, okay? Well, original Medicare pays its part, but that leaves you owing the Part A deductible, the Part B deductible, and that other 20%. So there's two ways to get coverage. We're going to talk about that a little bit later on. But right now I'm just going over Part A, B, C, D. So Part C is just another name for a Medicare Advantage plan, which is one of the two ways to get coverage to help offset those costs. Part C, or Medicare Advantage plans, are good anywhere you have an emergency. Anywhere you have an emergency. Otherwise, you have to be in your service area. I have a story. I have a friend who lives in Florida, and I wrote her policy several years ago, and she called me screaming a couple of weeks ago, and she said, I'm in Michigan. I came to my 50-year class reunion, and I got COVID. No doctor will take me. The insurance you gave me is no good. She's on a Medicare Advantage plan. I said, Renee, go to the ER. They're going to take you. They're going to give you the care that you need. She was like, okay. So she does. I called her back, a few days later. Renee, how are you doing? Yeah, you're right. This insurance worked just like you said. I went to the ER. They took me in. I got my meds. I'm doing better. But now that, hurricane just went through Atlanta. Not Atlanta, through Florida. And she said, now I think he's going to, blow my house down. So that I couldn't help her with. But poor Renee was not having a good week that week. Anyway, so Part D is probably the only thing that's easily identifiable with what it may mean, because A, hospital, B, medical, C, advantage, finally D is something we can understand. Okay, so a Part D is a prescription drug plan, and those plans come two ways. You can either get them built right into your Advantage plan, or you can purchase a standalone drug plan. Now, one thing to remember about Part D is they do have a network of pharmacies, okay? So I want to talk about Part D a little bit. So there's so many different Part D plans that are available to you. All of them have a formulary. Well, a formulary is just another fancy word for the medications that they have that they offer. There's also something called a medication or a tier exception. So every year you purchase your drug plan based on the medications that you're on now, okay? Now one thing, all of these drug plans have like between 3,000 and 4,000 drugs in them, okay? But we have to put you on a plan that covers your medications. However, we're not psychic. We don't know what the doctor is going to prescribe us during the course of the year. So if the doctor puts you on a plan and that drug's not in your that drug is not in your plan, then the doctor can ask for a drug or medication exception, or if that drug is way out of your budget, they can also ask for a tier reduction or exception. And then I'm sure most of you probably are familiar with prior authorizations, because at one point in your life you may have been on a medication that required prior authorization. And then step therapy. So step therapy is, say you're on medication and it costs a lot of money, or there's not a lot of that particular medication in the specific area that you live in. The insurance company may ask you to step down and take a drug that costs less. If you have a reaction or it doesn't work, you're allergic, they'll step you back up. So that's the meaning of step And then quantity limits. Let's face it, they're never going to give you an excessive amount of narcotics so you guys can go work bad neighborhoods on the weekend, right? Okay, y'all know about that one, right? Now, let's go back and talk about preferred and standard pharmacies. So, if you guys are already on a plan, I want you to go home and do this. I want you to call the 800 number on the back of the card and tell them which pharmacy you use to get your medications filled. Because if it's a preferred, you're going to pay less than if it's a standard. Because all these plans, regardless if you get your drug plan through an Advantage plan or a standalone drug plan, they have a network of pharmacies. And a good example is, say you're tier 1, okay? Your tier 1 drugs may have zero copay or may only cost you $1 for a 30-day supply, as long as you're going to a preferred network. If you go to a pharmacy out of network, that same tier 1 drug that you get for free, or practically for free, could cost you $20 a month. So I hope this helps somebody in this room. And spread this news. Tell your neighbors, tell your friends about this. Not everybody is fortunate enough to come and hear somebody speak. And my whole goal is to help you guys, okay? Now there's 2 ways to get coverage to offset the cost of original Medicare. One is an Advantage plan, the other one is a Medicare Supplement plan. If you get that, you're going to need a standalone drug plan. So some of the characteristics of a supplement plan, which is also known as a Medigap plan, because it helps fill in those gaps left open by original Medicare. Number 1, there's no network. And so what that means to you is you can go to any provider in the nation as long as they accept Medicare. Okay? So as long as they accept Medicare, you can go anywhere to get your treatment. They're not going to pay for your travel expenses, but if you want to go to Mayo Clinic, they'll pay for your expenses as if they lived, right around the corner from you. There's no referral. You don't have to go to your primary care if you need to go see your cardiologist or whatever it may be. And most of them they're going to have a monthly premium. However, they may have a deductible. Now, the rule on that is, for those of you who are on Plan F, as in Frank, okay, as long as you became Medicare eligible before January the 1st of 2020, you could get a Plan F plan. You can still get a Plan F, but you would have had to become Medicare eligible before January 1, 2020. It was the most comprehensive because Medicare paid its part, your Plan F paid the Part A deductible, Part B deductible, and the other 20%. After January 1st, 2020, the most comprehensive plan that's available is called a Plan G, as in George, okay? So with a Plan G, original Medicare pays its part, your Plan G pays the Part A deductible, you pay the Part B deductible, and your Plan G pays that other 20%. Let's talk about some of the characteristics of an Advantage plan. Now, an Advantage plan is not a supplement plan. As a matter of fact, sometimes they're referred to as replacement plans because they offer all of the benefits of Part A and Part B, and usually benefits like dental, vision, hearing, over-the-counter, gym membership. They are service area specific, and they do have a network of doctors. Now, with an Advantage plan, you will have co-pays and co-insurance and a maximum out of pocket. Original Medicare does not have a maximum out of pocket. So Advantage plans do have a cap, and you may or may not pay a monthly premium. Okay, if you do, it's going to be like under $50 a month. Some of the types of Advantage plans is Hmos and Ppo. An HMO means you must use providers in the network or pay the whole bill. Okay? A PPO gives you the flexibility to go out of network, but you'll pay a higher cost. So if you guys are on an Advantage plan, Go home and look. If you see the HMO, make sure you always stay in the network so you don't pay the higher cost. So you don't pay the full cost. There's specific types. Dual are for people that are on Medicare and Medicaid. So if you know somebody that falls into that category, we can get them many more benefits, okay, if they're just on Medicare and Medicaid. And VA, a few years ago, the federal government created plans that's just for veterans. So thank you for your service if you fall into that category. And with those, you can get dental, vision, and hearing, and sometimes a reduction on your Part B. And then chronic is specific to the state. For the state of Georgia, it's folks with heart problems and diabetes. That means you can get your medications, those two medications, at a less cost. Now, if you retired from the railroad, if you're an employee, if you're on TRICARE or CHAMP VA, you don't ever want to enroll in one of these plans, one of these individual plans. Do not call those 800 numbers, okay, on TV that you see. Those people are not your friend. As a matter of fact, what it says in the fine print is we are not an insurance company. We're a marketing company. We're going to sell your information to an insurance company. Okay, and these insurance companies pay big bucks for the leads that they get from them, but their main thing is whenever you call, you're probably getting a call center like in Pakistan or the Philippines, somewhere. And those people's goal is to connect you immediately with an agent who's going to present you with a hard sell, and they don't care what plan you're on, they're going to discredit it. So you guys, please do not call those 800 numbers. Joe Namath is not your friend over there. I promise you, okay? He needs to stick to pantyhose. And for those of you who are about my age, you know what I'm talking about. The other thing that's important that you know is if you retired from a company and they're offering you retiree plan and you enroll in an individual plan, guess what? You can't ever go back, because once you're out of their nest, okay, they're not going to say, oh yeah, come back so we can pay your insurance the rest of your life. They're going to go, say la vie, baby, you're out of here. So it's important to work with a broker who comes from a place of integrity. Now, a broker is somebody who contracts with most all of the companies, so they can do a comparative analysis between the plan that you're on and all of the other plans available. So LIS is just another word for a low-income subsidy or extra help, and that's a program to help low income with their drug cost. Irma is the opposite end of that spectrum. Irma stands for income-related monthly adjustment amount. I never try to say that after having a glass of wine. There is a 2-year look back, always. So for 2022, they're going to be looking at your MAGI, your Modified Adjusted Gross Income, on your taxes for 2020. If you make $91,000 single, you're married, filing joint, you can make up to $182,000, and you'll pay $170.10 for your Part B as a baby. Now, if you exceed that threshold of those, either one of those numbers, then there is an escalated chart, and it goes up in increments up to $750,000 or more. So, if you are high income, you could literally be paying like $500 a month for your Part B. How do you avoid penalties, enroll on time, and never disenroll? What happens if I'm on an Advantage plan and my provider goes out of network? So this year, we had Blue Cross Blue Shield go out of network with Northside. We had United Healthcare go out of network with Wellstar. I'm sure you've all heard it because it was on the news all the time. And trust me, our phones was ringing off the hook. So this is the deal. If you were on an HMO and you went to one of their doctors or hospitals, you got to pay the whole bill. If you were on a PPO and they would allow you to go. You could go, but you would pay a higher cost. If you were on a Medicare Supplement plan, remember Medicare Supplement plans do not have a network of doctors or providers. You can go anywhere that they accept Medicare. So if you were on a supplement plan, you were not affected by this. Some of the changes for 2023 is this year, as a result of those nasty TV commercials, we have to record all calls between the agents and the client. Now, every time you've ever called an insurance company in your life, they say, this call may be recorded for quality assurance. Okay, we have to do the same thing. And the recordings have to be kept for 10 years. There's also a disclosure that must be on all marketing materials. We don't have to put it on our business card. It has to be on everything else. So if you go to my website, it's Medicare and Other Red Tape, or to make things simple for you guys, I also just chose BonnieDowds.com, so you don't have to worry about misspelling something or forgetting one of those letters. But as of October 1st, this is on my website. The disclosure reads, we do not offer every plan available in your area. Any information we provide is limited to those plans we do offer in your area. Please contact Medicare.gov or 1-800-MEDICARE to get information on all your options. Well, let me tell you, boys and girls, there's some plans that are not worth your time or mine, okay? Not every plan that you see on Medicare.gov is a good plan. I made the decision years ago, if a company has not been in business for 3 years, okay, then they're not established. I'm only going to put you guys on companies that are solid and established. The other thing is, even if a company is a household name, but they're new to the Medicare industry, or they're new in this area, I'm never going to put you guys on one of those plans. And I'll give you a good example, and I can only say this whenever I'm talking in Atlanta because people have lived through this. It's probably been about 6 or 7 years ago, but Piedmont hospitals and providers and Wellstar hospitals and providers got together and thought that they were going to create a Medicare Advantage plan. Well, they did. The first year, they enrolled 4,000 people. Good. The second year, they enrolled an additional 7,000 people. That's good, too, except there were more sick people than there were well people. So before that plan could begin, that third year, they went out of business. So you know what happened? Everybody was on that plan. Now they're mad at me because they trust me to put them on a plan that they can depend on that company to pay their bills, and it's going to be there. So if these people were in the middle of getting a procedure, they're really upset. So I had to change every one of their plans, and they're upset over the disruption. So I don't like this statement, and I think it's going to create a lot of mistrust in agents who do come from a place of integrity. Now, those folks on TV, that's the reason why we're having to pay this. Okay, what happened here? Yeah, there we go. So both of those requirements are in direct response to the crazy TV commercials. I mean, face it, Joe Namath gets up there and says, you may be missing benefits. You could be having $170 put back into your account. You know, we offer dental, vision, and hearing. We're going to come over Tuesday night and walk your dog and cook your dinner. I mean, isn't that kind of they sound like used car salesmen, and that's exactly what I wrote in the AJC, if you guys read my article, Sunday, October the 2nd. So let's talk about prescription drugs, what's going to happen for next year. So this year, the deductible's $480. Next year, that's bumping it up to $505. And a bill was passed to have a $2,000 cap as the maximum amount of benefit. But guess what? It's not going to start until 2025. That's not going to do any of us any good today. And I got this, actually, Dr. Nina emailed it to me, and I told her I was going to put it in my presentation, but I'm running a little bit late, and I know you all can read. If anybody wants this, I will email it to you, but I do want to move forward because I've got some important information that I wanted to discuss just for you. So the Part B premium, Part A premium, for people who never worked and paid into Medicare FICA taxes, or, sometimes people want to move to our country, because we have a wonderful country. If they never pay into Medicare taxes, you can actually purchase Part A. It's expensive, it's $506 a month. The Part A deductible is increasing. This year it's by $1,556. It will be $1,600 next year. The Part B premium and deductibles actually decreasing a few bucks. So this year is $170.10. It's going down to $164.90 beginning in 2023, and the deductible is being decreased from $233 to $226. Well, this is really good news because for the first time since 2012, okay, it's been that long, this is the first time we've had a reduction in our Part B. But what's really cool about this year is COLA's going up and Medicare's going down, so you may actually realize a profit or an increase, okay? More take-home money. It doesn't cost anything for us to review your plan. That's not what I was wanting to talk about right now, though. Let's go back. This is the part, for some reason, it didn't transfer on my PowerPoint here that I wanted to go over with you. But this has to do with stem cell, also known as bone marrow, transplant. Your Part A, remember I was talking about that earlier, Part A is hospital, okay? Your Part A is what covers bone marrow transplants under certain conditions. Now, Medicare may cover your transplant even if the transplant is done at a center that isn't approved by Medicare. You would definitely want to ask your doctor and get approval from Medicare on that, okay? I see many of you writing, so I'm just going to pause a minute. So Medicare Part A may cover your transplant even if the transplant center isn't approved by Medicare, but you would have to get it approved through your doctor or by Medicare. Okay, don't use it unless you get that approval, otherwise you have to pay the whole cost. Now, Medicare covers part of the cost of two types and applies it whether you have it done inpatient or outpatient. Okay? It also costs like $5,000 to $50,000 to get a transplant. So check with your insurance. Do your research before financially committing to this. Check with your doctor and the entire procedure, like anybody else that may be involved, like an anesthesiologist or some type of testing or something, okay? So do your homework first before you do that. One thing that somebody had asked me earlier is donors never have to pay. The National Marrow Donor Program pays for them, okay? There's much information on Medicare.gov if you Google it, and I had literally copied and pasted into my PowerPoint several pages that I wanted to go over specifically with you. I am glad that I had the opportunity to go over all this basic stuff that applies to everybody, but if you guys will go read that, then that is the information specifically that you need. Now, I was telling you earlier that my brother, am I doing good? Am I doing okay? I lost you. Okay, great. My brother had this, was in the hospital for 4 months at the end of last year. And I found out at that time that the doctor and the staff, they, at Northside, okay, I'm only familiar with that particular group, but they had a pharmacist on board that worked with them. So they would help the patients with their medications. I had the privilege to talk to the nice folks out here with Walgreens, and he enlightened me on several things about using, or the importance of using a community pharmacy. Now, there's pharmacies on every corner, okay, but they're not community pharmacies. So this doesn't specifically apply to Walgreens. I'm sure all of the different companies have it, but a community pharmacy is going to be one that, or it will be a location where they're going to be more involved with your medications because of the severity of whatever medical issue you may have. So number one, a community pharmacy is going to have access to drugs that have a limited quantity in this area. So remember, I was telling you that's one of the things that that's one of the characteristics of a Part A plan is quantity limits. So when you guys, or if you know anybody on any that has any other severe medical illnesses, having access and being able to get the amount of medications you need is of utmost importance, you know. Also, they know to go ahead and ask for drugs that require prior authorization. Because if you don't have someone close to you, a caregiver, you may forget, oh my God, I'm taking my last pill of whatever it may be, and we've got to get prior authorization. These community pharmacies, okay, like I say, it's not just specific to Walgreens, but they help you with that. They go ahead and find out from the doctors. And then another thing that community pharmacies do is they help with copays, because they can do a foundation application right online for you. That's really important, because some of these medications millionaires can't afford. I mean, I've seen drugs that were like $20,000, $50,000, and that's a month, okay? So nobody can pay that. And then the other thing that community pharmacies do is they follow up. If you don't pick your medications up, they call you. If you don't pick it up after the first call, they call you a second time. If you don't pick it up after the third call, they call your doctor and want to know how you are doing. So, at this time, I would like to open, well, I have one more thing that I have to say. The federal government, get me. This is the last thing. I'm not affiliated with the U.S. government, federal, state Medicare programs. So, if you have any questions, please raise your hand, and I would like to address them at this time. Yes, your question, please.
Earlier you mentioned about Blue Shield and United Healthcare issues.
I can't hear you. Please speak louder.
Earlier you mentioned about Blue Shield and United Healthcare with Wellstar and Northside. Did they ever get that resolved?
I think they did. Yeah. She asked if Northside and Wellstar ever got together and renegotiated the contract. I did. If you have an HMO or a PPO, if you have an Advantage plan, call and ask, okay? Because I don't know that for sure. And I don't want you calling me up and yelling at me because I didn't know, okay? So, yeah. I mean, I heard it on the news that they did. I don't know if anything's gone sideways since the last time I listened to the news. Yes, what's your question?
Is where on the earlier slide you had, you said that Medicare take care of global medical equipment. Is there a list of the things that they consider global?
Her question is there a list for your durable medical equipment, okay? You can call the insurance company and ask them attached to me so I can move around. Okay, so what was your question?
About the durable medical equipment and the list, and once you get the order from the doctor, do you still have to get it?
Yeah, so she's asking about durable medical equipment. Okay, you have to get an order from your doctor in order to get like a wheelchair or something like that, okay? Once you get that order, if you're on a Medicare Advantage plan, okay, you'll want to call the 800 number on the back of the Advantage plan or go online and find out with Medicare plan, with that specific Medicare plan, what providers do you need to go to get that to order your durable medical equipment from, okay? Because remember, HMOs, if you go out of the network, you pay the whole bill. PPO, as long as you stay in the network, you'll pay a lower cost, okay? So it's really important, even with durable medical equipment, to find out who's in the network. And you can always find out, like I say, by calling the 800 number on the back of your card. But if you don't want to stay on hold forever, then just go to the website, but make sure that you are looking at their Medicare plans and the specific plan that you're on. Thank you for asking that question. That's very good. Anybody else have a question? Yes.
I'm on one of the long-term oral Hmos, and it's an expensive drug. It's about $10,000 a month. It's billable. I'm on a private company plan now, so it's not so expensive, and I've got a high deductible plan, so it's zero after I reach an out-of-pocket max. Is there a type of plan, or is that per fee once I get to Medicare, or is that sort of thing not covered at all?
Okay.
Lots of drugs like that.
So the drug you're on is like $10,000 a month?
I've been on a drug like this now for about 8 years.
I would, talk to your doctor, your pharmacist, and see if they can get that drug reduced, either by going to the pharmaceutical company or going to some foundation to see if they would get that medication for you.
That's what I do now, which gives me a discount.
Sure.
But those plans specifically say they're not valid once you're on Medicare or government-funded types of plans.
You're right. They do say that you're not. That's the reason why you have to work with either the pharmacist with your oncology group or the pharmacist at the, like at Walgreens or CVS or Kroger or whatever, so they can help you get enrolled in one of those plans, okay, or goes directly to the pharmaceutical companies, okay? All that's income-based, okay, so unless you are a multi-millionaire, you know, I'm sure you haven't been paying $10,000 a month for 8 years, or if you do, God has richly blessed you. Okay. Next question. Just remember, no question with Medicare is stupid, because Medicare is so confusing. It's, you know, whatever question you may have, I'm sure somebody else is trying to come up with an idea or a way to ask that question. Well, I would like to thank you all for coming. If you have any questions, please see us.